Welcome to the Basics online module for a simple review of substance use, treatment, and recovery. Let's get started with a review of addiction substance use disorder, or SUD. We'll cover in this section information about the current public health crisis driven by opioids, which include prescription pain medication and illicit or illegal opioids such as heroin. As reported by the Centers for Disease Control, or the CDC, the United States is in the midst of an opioid public health crisis, with every American state, county, socioeconomic, and ethnic group impacted. The total economic burden of prescription opioid misuse alone in the United States is estimated at $78.5 billion a year, including the costs of healthcare, lost productivity, addiction treatment, and criminal justice involvement. According to the CDC, drug overdose is the leading cause of accidental death in the United States. In fact, overdose is the leading cause of death for Americans under 50. In 2017, more than 70,200 Americans died from a drug overdose. This represents a 10% increase over the prior year. This is more deaths than from car crashes or guns, both homicides and suicides. Opioids account for 68% of all overdose deaths. With more than 47,000 Americans dying from an opioid overdose, you are more likely to die of an opioid overdose than from a car accident or a gun. It is likely that each of us will know someone living with addiction to drugs or alcohol in our lifetime, as it affects millions of Americans. According to the Substance Abuse and Mental Health Services Association, or SAMHSA, an estimated 20 million Americans aged 12 or older have a substance use disorder, SUD, related to their use of alcohol or illicit drugs. 14.8 million Americans have an alcohol use disorder, and 8.1 million Americans have an illicit drug use disorder. While this is a large number of Americans, it is important to understand that another estimated 23 million Americans are living in recovery, meaning their chronic illness is not active. In Indiana, nearly 25% of Hoosiers aged 12 and older engage in binge drinking in the past month, and more than 1/10, 11%, used an illicit substance. Specific to prescription opioids, 4.8% reported misuse within the past year. This is above the national average of 4.1%. Furthermore, 7.1% of Indiana residents met criteria for substance use disorder, SUD, in the past year, and 6.6% needed but did not receive treatment for their SUD. SUD has a tangible impact on Hoosier families. During state fiscal year 2017, a total of 12,786 children were removed from their homes by the Department of Child Services in Indiana. Almost 2/3, 62.8% of these removals were due to parental alcohol and/or drug use. The 2018 National Survey on Drug Use and Health found that 68% of the estimated 53 million illicit drug users, ages 18 or older, are employed full or part-time. The same survey found that most binge drinkers and heavy alcohol users are also employed. Of adult binge drinkers, 76%, or 50 million, are employed. Of adult heavy drinkers, 75%, or 12 million, are employed. Alcohol use disorder is the largest SUD, affecting 14.8 million Americans and nearly 25% of Hoosiers. According to the CDC, this disease is a significant drain on the American economy. Healthcare, $28 billion. Workplace productivity, $179 billion. Collisions, $13 billion. Criminal justice, $25 billion. Combined, that is a staggering $249 billion loss. More than 53 million Americans reported using an illicit drug in 2018. Marijuana, 43.5 million, which was an increase over the past year. Prescription opioids, 9.9 million, which was lower than the past year. Prescription tranquilizers, with the majority being benzodiazepines, 6.4 million, which was similar to the past year. Hallucinogens, 5.6 million, which was similar to the past year. Cocaine, including crack cocaine, 5.5 million, which was similar to the past year. Prescription stimulants, 5.1 million, which was lower than the past year. The last three were all at similar rates to the last year. Inhalants, 2.0 million, methamphetamines, 1.9 million, and heroin, 808,000. While doctors have known for some time that patients frequently overdosed on a combination of opioids and alcohol, or opioids and benzodiazepines, there has been a new trend emerging. Fentanyl is being used to lace a wide variety of drugs, including marijuana, said Nora Volkow, MD, Director of the National Institute on Drug Abuse, speaking at a 2018 conference. Synthetic opioids, illicit fentanyl, appear to be the primary driver of cocaine-involved death rate increases and psychostimulant-involved methamphetamine deaths. In 2017, opioids were involved in 73% of cocaine-involved and 50.4% psychostimulant-involved overdoses. In many cases, both street-level drug dealers and the people who use cocaine are unaware that the cocaine is laced with fentanyl. The CDC provisional data from 2018 indicates that deaths involving cocaine and psychostimulants are continuing to increase. Let's go a little deeper in the national opioid public health crisis. Every state in America is affected, some more than others. CDC 2017 state data shows the overdose age-adjusted rates for a view across America. The darker the red, the greater the overdose death rate for that state. Indiana is ranked 14th in the nation for overdose deaths, and for the second year has been on the list of states with significant increases. Drug overdose deaths are preventable. They fall into a category of accidental or preventable deaths. Steps can be taken to reduce the rate of deadly overdoses through raising awareness and education, and with the use of naloxone, or brand name Narcan, the opioid overdose reversal drug. Drug overdose deaths in Indiana have been on the rise for almost 2 decades, with a loss of more than 15,000 Hoosiers since 1999. In 2017, the age-adjusted rate of drug overdose deaths increased significantly in Indiana by 22.5%, increasing from 24.0 to 29.4 deaths per 100,000 Hoosiers. Indiana had the third highest overdose rate increase in the nation, behind only New Jersey, 29%, and Nebraska, 26%. More recent provisional data from the CDC estimates Indiana's 2018 overdose deaths decreased 14% from 2017. This is a positive trend and indicates that the solutions deployed across federal, state, and local communities are beginning to have a positive impact on reducing the health crisis effects. There are 4 primary contributors to the health crisis: First, some pharmaceutical companies misrepresenting the addictive nature of prescription opioids, and healthcare providers began prescribing them at greater rates. Second, this led to widespread diversion and misuse of these medications before it became clear that these medications could indeed be highly addictive. Third, overdose death rates began to increase. Fourth, as did the rates of opioid addiction, opioid use disorder. America's relationship to pain ratings is also part of the story. In the 1990s, pain was added as a fifth vital sign. Many of us have experienced being asked by our nurse or doctor to rate our level of pain during an exam or hospital stay. Pain level is difficult to measure. It cannot be measured objectively as one can with blood pressure or heart rate. As well, hospitals and practices received incentives and reimbursements by how well a patient's pain was managed through patient satisfaction surveys. This encouraged liberal pain medicine prescribing practices. More recently, the American Medical Association voted to remove pain as a vital sign. Beginning in 2018, the federal government announced that it would not pay out financial rewards to hospitals that did a better job reducing pain scores as part of the value-based purchasing program. Opioids differ in how they are made and in their potency. For example, morphine and codeine are natural opioids originating from the poppy plant. Heroin, oxycodone, Vicodin, Percocet, and many others are semi-synthetic, which means they are part natural and part man-made. Drugs such as fentanyl and methadone are fully synthetic or fully man-made. Another difference among the opioid family is the potency or strength of the opioids. For example, an opioid such as fentanyl is 50 to 100 times more potent than morphine. Regardless of the form, opioids can be addictive due to their chemical makeup and effects they have on the brain. A review of the definition of addiction. The American Society of Addiction Medicine is the nation's leading addiction medicine society representing physicians, clinicians, and other professionals. Addiction is a primary chronic disease of brain reward, motivation, memory, and related circuitry. Dysfunction in these circuits leads to characteristic biological, psychological, social, and spiritual manifestations. This is reflected in an individual pathologically pursuing reward and/or relief by substance use and other behaviors. Addiction is characterized by inability to consistently abstain, impairment in behavior control, craving, diminished recognition, or awareness of significant problems with one's behaviors and interpersonal relationships, and a dysfunctional emotional response. Like other chronic diseases, addiction often involves cycles of relapse and remission. Without treatment or engagement in recovery activities, addiction is progressive and can result in disability or premature death. The Diagnostic and Statistical Manual of Mental Disorders, or DSM-5, is the authoritative guide to the diagnosis of mental disorders, including addictions. DSM-5 characterizes all substance-related addictions as substance use disorders. Substance use disorders occur when the recurrent use of alcohol and/or drugs causes clinically significant impairment, including health problems, disability, and failure to meet major responsibilities at work, school, or home. The birth of addiction medicine in modern times is sometimes credited to Calvinist theologians in the 17th century who offered explanations for the phenomenon of compulsive drinking, which were later accepted by physicians. Some of the more notable historical marks in addiction and substance use disorder advancements. In the 1950s, scientists began to understand addiction as a brain disorder. Olds and Milner's studies of rats located the parts of the brain affected. In the 1960s, the insurance industry begins to reimburse the treatment of alcoholism. The American Medical Association, AMA, identifies alcoholism as a complex disease to be addressed by all members in health professions. In the 1980s, researchers and medical professionals began studying the ways that addiction and mental health issues interact with each other. In 1994, neuroscientists Volkow and Shelbert showed the effects of substance use disorders through PET scans of the brain. And today, there is more research underway and education needed. It has been nearly 70 years since the science and medical community have defined addiction as a chronic brain disease. Still today, many think it is a moral failing. A review of the disease model and the effects on the brain. There is a large body of research showing that there are differences between those who use substances and those with substance use disorder. One can be mentally dependent on things, but addiction suggests a more severe turning point where changes in the brain occur. It is important to understand that not everyone who misuses drugs or alcohol will develop the disease. A person does not choose to become addicted. They are not flawed or wrong. The person's body responds differently when exposed to alcohol and drugs. Addiction changes both the brain structure and function. What began as a choice is hardwired as critical for our survival. Let's look at this in more detail. Our brains are wired to increase the odds that we will repeat pleasurable activities. This occurs in the brain's reward pathway, which is responsible for rewarding behaviors that are important for our survival. Our brain decides what behaviors to do based on motivation, which is driven by a brain chemical called dopamine, which is released when it recognizes that something is good and important for our survival. Dopamine not only contributes to the experience of pleasure, but also plays a role in behaviors, learning, and memory, three key elements in the transition from liking something to becoming addicted to it. Drugs release an incredible amount of dopamine at far greater levels than other activities such as eating or drinking, flooding our brain. Drugs and alcohol fool the brain that they are important for survival, more important than food, water, sleep, and interacting with family and friends. Drugs can alter important brain areas that are necessary for life-sustaining functions and can drive the compulsive drug use that marks addiction. Over time, areas of our brain responsible for decision-making, judgment, learning, and memory physically change, and certain behaviors are altered, hardwired. With SUD, the affected brain has remapped itself to make feeding the addiction the most natural and most important course of action. Our brains have the power to change, to reset, undo the remapping. New pathways can be formed via the development of healthy behaviors and thought processes. A review of cause and risk factors. As with other diseases, vulnerability to the disease of addiction varies from individual to individual. Not one single factor, but several factors contribute to the development of addiction. The main factors fall within two categories, biological and environmental. Environmental factors include home environment, history of abuse, family's use, beliefs, and attitudes, exposure to a peer group that encourages drug use, community attitudes, and poor school achievement. Once you started using a drug, the development into addiction may be influenced by biological traits, such as genetics, gender, or mental disorders, which may delay or speed up the disease progression. Early use of a substance or drug increases one's risk factor. Research shows that the earlier a person begins to use drugs, the more likely he or she is to develop serious problems. How the substance is administered, or the route in which the substance is used, increases the risks. Smoking a drug or injecting a drug will increase the drug's addictive potential due to the speed of the substance reaching and affecting the brain. The substance itself also has an effect. Drugs such as cocaine, methamphetamine, nicotine, opioids, and alcohol have a higher addiction rate due to their effects on the brain's mechanisms. Finally, the lower the cost and availability of the substance will affect individual risk factors. In general, the more risk factors a person has, the greater the chance that taking drugs, using alcohol, will lead to changes in the brain mechanism, leading to addiction, substance use disorder. The majority of those who have a substance use disorder started using before age 18 and developed their disorder by age 20, prior to the brain being fully developed. The likelihood of developing a substance use disorder is greatest for those who begin use in their early teens, prior to the brain's full development during the early to late 20s. For example, 15.2% of people who started drinking by the age of 14 eventually develop alcohol use disorder, as compared to just 2.1% of those who wait until they are 21 or older. Research shows that adverse childhood experiences, or ACE, have a profound effect on health, functioning, and addiction over the course of a lifetime. The ACE study is a large, longitudinal study now co-sponsored by Kaiser Permanente and the Center for Disease Control, or CDC. The ACE test asks about 10 types of negative childhood experiences and then tracks health outcomes. Risk for addiction, other health problems, and suicide all go up with each adverse event. A child who experiences 4 or more traumatic events is 5 times more likely to develop alcohol use disorder, 60% more likely to become obese, and up to 46 times more likely to become an injection drug user or IV drug user than the general population. A review of signs and symptoms. The DSM-5 states that in order for a person to be diagnosed with a disorder due to a substance, they must display 2 of the following 11 symptoms within 12 months. Signs 1 through 4 are related to loss of control, taking larger amounts for longer than intended, wanting to cut down or quit but unable to, increasing time getting, using, and recovering from the substance, and craving. Signs 5 through 9 are related to continued use despite consequences, failure to carry out work, school, and home obligations, social or interpersonal problems, reducing or stopping other important activities, use in dangerous, hazardous situations, and despite health problems caused or worsened by it. And finally, signs 10 and 11 are related to physical change, tolerance, needing more of the substance to get the same effect, and withdrawal, development of withdrawal symptoms which can be relieved by taking more of the substance. According to SAMHSA and National Alliance on Mental Health, or NAMI, the coexistence of both a mental health and a substance use disorder is referred to as co-occurring disorders, COD, or dual diagnosis. Either disorder can develop first. 9.2 million adults in the U.S. have a co-occurring mental illness, SUD disorder. People experiencing a mental health condition may turn to alcohol or other drugs as a form of self-medication to improve the mental health symptoms they experience. However, research shows that alcohol and other drugs worsen the symptoms of mental illness. The best treatment for dual diagnosis is integrated intervention, when a person receives care for both their diagnosed mental illness and substance abuse. What an employer may notice in the workplace: absenteeism, late increased use of sick days, taking time off with little advance notice; performance issues, missed deadlines, quotas, fail to complete assignments, frequent accidents or injuries; strained work relationship, short-tempered, argumentative, mood swings, isolation; physical, low personal hygiene, slow or slurring speech, lethargic. If you suspect or see indications of substance use, refer to your business policy for action that you should take. You may also wish to refer to Module 5, Responding to an Employee's Harmful Use of Drugs from the Right Dose. Modules 2 and 4 may also be helpful. Be mindful that some of the signs of SUD may be due to other mental health disorders. Hence, if suspected, an assessment by a trained professional is required. It's important to talk about denial's role in addiction. Denial can be defined as selective ignoring of information or refusing to acknowledge the reality of one's situation. Denial is prevalent in many aspects of life. With addiction, it is central to the explanation of why an individual persists in using despite evidence of harmful consequences. Denial distorts reality, often will lead to isolation as the individual begins to pull away from those who are confronting the situation, and it can develop codependent behaviors as loved ones try to help the individual address the reality, the addiction.